Okay, here we are looking for a bladder of recurrent cystitis lady. Here, these are trigonitis areas, and we have many leukoplakia lesions here. Look at these abnormal tissues. They are all changed tissues because of cystitis. When we look, this is normal bladder mucosa, but the part that coming into contact with this cystitis, you see the opposite wall, back wall of bladder, which is in contact with this trigone when the bladder is empty, it is also affected. You see the red tissue here, the red area. This area is in contact with this area. So the bacteria goes inside the bladder from urethra here. This is urethra. It looks healthy. The bacteria enters and settles first in this part of the bladder, which is the entrance of bladder. Then it disseminates into this part, the opposite wall, which is in contact with trigone when bladder is emptied. Look, this other parts of the bladder is now healthy, but if she loses too much time, by the time the other parts of the bladder becomes ill too. Now I am emptying the bladder to see if this part will come into contact with that part. Now it's closed and I am filling it. Yeah, this red area. This part is coming into contact with this trigone area. Okay, I will fulgurate these.
Alıyorum. Bu başlattım kayıt.
Now we mark the borders and now begin the fulguration. Yes, it's cleaning nicely. These parts are ill tissues. We have to clean all of these.
Başlattım.
Okay, now we finished the fulguration. We saved the rhetoric orifices, and we fulgurated the unhealthy tissue in trigone. And her bladder has some little bleedings when they are stretched. And the opposite wall here, the unhealthy tissue, we fulgurated this area. Okay, I think this is enough. And now we will look into vaginal part. Okay, we now look at the vaginal part. The vaginal wall is normal. She has a little discharge. And this is cervix uteri, which seems normal, quite inflamed. Not too much, but little inflamed here. But that will not cause a problem. Okay.